So what we're going to be talking about today are infectious diseases in comics and popular media, fact, fiction, or a little bit of both. And for those of you that don't know me, I'm Dr. Ryan Moenster. I'm an associate professor of pharmacy practice here at St. Louis College of Pharmacy at USHP. So what I thought we'd start out by doing is I want to give you a little bit of timeline of comics in the US, and then again, a very little timeline of infectious diseases around the same time at sort of the burgeoning era or the golden era of comics. So the first comic in a newspaper in the United States was actually called The Yellow Kid, and it was published way back in the middle of February in 1896. Now, these were newspaper strip comics, but the first modern comic book was actually titled Famous Funnies, and it was released in the US in 1933. But this was a little bit different because it was a collection of newspaper humor strips that was published in a book form where someone could read all of them. The first superhero comic is generally thought to be The Phantom, and those were published in the earlier 1930s. And our big seminal superheroes started to appear towards the end of that decade, with Superman debuting in June of 1938 and Batman about a year later in May of 1939. So I had the question, how big are comics even today? Well, they've certainly increased in value a ton. And you can see by my last bullet point there, in 2016, the US and Canadian comic book market was valued at about 100 or $1.09 billion. Lots of money, and certainly that increased greatly over time. Now let's look at infectious diseases, or a brief timeline of infectious diseases in the US and sort of see where these two things intersected at, again, the beginning of the golden age of comics. So if we look at 1918, so just 20 years before the appearance of Superman, that's when we had the great 1918 influenza pandemic. Huge number of deaths worldwide, about 50 million, and 675,000 people within the United States died as well. Now, while this didn't necessarily affect comic book readers, probably in the late 1930s, because we're going to assume they weren't born, it absolutely had an impact on those that were writing the comic strips and comic books for those future readers in the late 30s. Now, I want to juxtapose this with death rates from infectious diseases in the US, moving closer to the beginning of the golden era of comics. So the US death rate from infectious diseases in 1937 was 283 deaths per 100,000 persons. And if we take the US population into consideration at that time, that's about 364,000, or a little bit more than 364,000 ID-related deaths per year. Now, for context, let's compare that to the US death rate from infectious diseases in 1996. That info is a little bit dated, but it comes from this really good JAMA article from 1999 that I was able to pull. And look how much those numbers went down. We were only faced with 59 infectious disease-related deaths per 100,000 persons, and that number was more than halved from what we saw in 1937 at only about 159,000 ID-related deaths per year. Let's also think about one of the great advances in medicine altogether, and particularly infectious diseases, was the development and commercial availability of penicillin. That didn't happen. It wasn't out to the public until about the middle of March in 1945. So a full 7 years or 6 years after some of these comics became to be available. So what does all this mean? Well, think about the impact that these common infectious diseases that we deal with now that are highly treatable, like pneumonias, like the flu, like skin and skin structure infections, those were really causing deaths and significant morbidity in patients prior to the advent of 1945. So it stands to reason that some of these folks may have thought you have to be almost a superhero to withstand some of these common diseases that were just running rampant across society. So here's the media that we're going to be covering today. I'll cover some in more detail than others. And the other thing I should say is spoilers abound for all of this stuff. So tune out now if you don't want to hear sort of the end result of what some of these series are. We're going to start out with one that I'm sure everybody is familiar with, if not from the comics, certainly from the AMC television show, The Walking Dead. So this started out as a comic produced by Image Comics, and it was created by Robert Kirkman and Tony Moore, and it enjoyed a really long run, actually starting in 2003 and just finishing up back in 2019 for a total of 193 issues. I bet you guys probably know the story of The Walking Dead even better than I do. But essentially, what we're faced with in the comics is uh, Deputy Rick Barnes in Kentucky is shot, and he wakes up in the hospital, and there's nobody around him. He's not sure what's going on. The last thing he remembers is being shot. So he gets up and wanders around this abandoned hospital until he stumbles into the cafeteria, and we see the panel on the right where he sees a bunch of these really creepy, really scary looking zombie folks in the cafeteria who try to attack him and eat him. And he has no idea at this point what exactly is going on. So we fast forward a little bit in this first issue, and he goes back to his house to try and find his wife, his child, and he encounters a neighbor. They hit him over the head with the shovel, and the neighbor, once he comes to and they realize that he's not a zombie, fills him in on a little bit of what's been going on. They don't really know. They just know that this is some kind of a pandemic. They're trying to get people to go to the major cities so that they can better be cared for and protected from the people who are infected with whatever this is at this time. We're also starting to learn some of the zombie lore here in that they can't be killed via conventional methods. They need to be either shot directly in the head, but everything else, it just doesn't really incapacitate them that much. So over on the right-hand panel, we just see a little bitty example from a future issue of what some of the zombies in this universe really look like. So there's these really deformed, certainly half-dead people who don't have much intelligence about them. The only thing they're trying to do is to consume meat, either from people or animals or whatever. That is their sole purpose. And they just continue to completely waste away or they just continue to try and eat meat until they are completely wasted away. So the thought at this point in the series is that the only way you can contract whatever is causing this disease is to be bitten by a zombie or encounter bodily fluids from them. But what we find out a little bit later, not all that much, these are some panels from about issue 15 that I thought are really interesting and are going to come into play a little bit, is that they discovered that pretty much everybody is actually infected with whatever pathogen is causing this disease, and it lays dormant. And if you die by other means, this virus essentially, or this pathogen essentially activates and allows you to come back from the dead as this zombie and then just do your zombie thing and look for food and try to eat whatever you can. They find this by, unfortunately having some people die by other means, and then they're just reanimated because they have this pathogen and it's lying latent inside of them. Now, I think throughout the series, it's always been kind of a mystery from the creators as to what the genesis of this was. Robert Kirkman has always been pretty tight-lipped about what exactly started this zombie plague, but actually fairly recently in an interview, I think back in October, he revealed that a space spore is what was the starting point for all of this. But again, I don't think that's appeared anywhere either in the comics or the TV show. So let's talk about our real world link for this. I've got a couple of them. The first things I'm going to talk about are prion diseases, particularly something called Kuru and fatal familial insomnia. Some of you may not be really familiar with what a prion disease is, so we need to talk about that for a second. So what are they? Well, they are not bacterial, viral, or fungal. What they are is an infectious misfolded amyloidogenic protein or proteins. So there's effectively no DNA or RNA present. What's happening here, a little bit of the pathophysiology, is we get these pathogenic amyloids, which are just aggregates of proteins that appear fibular in nature. They occur when previously normal proteins misfold, and they cause those proteins then, because they're misfolding, to lose their structure and function. The other thing these misfolded proteins do is they form these big, thick, fibrous plaques around healthy cells, and it disrupts their normal functions. The prions then these misfolded proteins can act as a template, and they sort of bump or convert other healthy proteins to turn into misfolded prion proteins. So you can see that once this develops and happens, it's just a big problem, and other normal proteins can get converted as well. Newsflash here, it was discovered back in 1983 that we all have prion proteins. And that's okay, though, because this is completely normal. It's just abbreviated PRP for the prion protein. It's a normal cellular protein, and it's encoded for by a gene on chromosome 20 that instructs our cells how to make it. And this gene is called PRNP. So here's just a little bit more of what it looks like over the next couple of slides. We see there the DNA on the right-hand panel. PRNP is the gene that encodes for the prion protein. In the middle there, we have a completely normal prion protein that's a cellular surface protein within mammals. But then on the right-hand side, this is an infectious prion protein particle that's made up of a bunch of misfolded proteins. So you can see that structure, proteins are large in general, but this is just really disorganized, really large, and it's going to wreak havoc on the surface of the cell, in addition to potentially causing other cells to form into these prion proteins as well, misfolded prion proteins. Here's another, I think, a little bit easier to digest picture. We have a normal protein on the left-hand side there. We can see still a complex structure, but if we look at a diseased prion protein on the right-hand side, in the red there, you see this essentially elongated beta-pleated sheet form, which causes these thick fibrous molecules. And you get a bunch of these together, you get something that just doesn't work right, and it wreaks a lot of havoc on the cellular level. How can you catch a prion? Well, prions are infectious. However, the good news for everybody is infection is actually the least common way of contracting a prion. They can either be acquired or infectious, genetic, so passed down, or probably to me the scariest is sporadic, like this will just happen. Now, generally, where the starting point for this, whether it's genetic or certainly acquired, comes from the ingestion of a contaminated or unnatural food source. And what I mean by that, unfortunately, is usually cannibalism. And that's going to lead directly into the first disease we're going to talk about here, which is Kuru. I think this one is incredibly interesting and unfortunately doesn't exist anymore. But it was associated with an epidemic in the 4A people of Papua New Guinea. What was noticed there is some of the 4A people had a disease, a condition, were behaving very strangely, and they had a lot of tremors. And tremors were a very common feature of this disease. Therefore, the 4A named the condition Kuru, which in their native tongue literally means trembling. The disease was first documented by Australian officers patrolling the eastern highlands of Papua New Guinea in the early 50s. And some officials reported reports state the Kuru that was observed in the 4A as early as 1910. In 1957, the disease was classified as an epidemic, and medical research on the indigenous people began. And this research led to the link that the condition was linked to the practice of endocannibalism by the tribe. This was a ritual that they practiced. So what happens there is the 4A ritualistically cooked and consumed body parts of their family members following their deaths. Now, this was a tribal ritual. It was a sign of respect and also a sign of mourning. And this was thought to free the spirit of the dead people. This disease disproportionately within the tribe affected women and children because they were the ones who were doing the majority of the cooking and the preparing of these people, and they would actually eat the brains of these deceased relatives and tribesmen. And unfortunately, the brains contained the highest concentration of the prions. Men were typically spared because, at least some of the most severe disease, because they consumed the muscles and other viscera. The modern theory on how this started was that at some point, a member of the tribe developed Creutzfeldt-Jakob's disease or mad cow disease, was consumed, and then that's how the prion was continually introduced and passed throughout the tribe. It's now extinct after the decline of this practice, secondary to some of that early research that was done in the 1960s. So let's talk about the symptoms. This is where we start to get pretty interesting, and we can see some links to some of that zombie behavior. The incubation period is incredibly long. It's anywhere from 10 to 15 years. Some of the general signs and symptoms are progressive ataxia, dysarthria, dysphagia, tremors, we've already talked about, motor dysfunction. And of note, there are some cognitive disturbances here that are observed with Kuru, but they're actually a lot less than some of the other prion diseases. There are 3 distinct stages here. There's the abundant stage, the sedentary stage, and the terminal stage. Abundant is mainly unsteady gait, some tremors, and dysarthria not as severe. With sedentary, we start to get a lot more severe where patients cannot walk without support. They have severe tremors, and then they start to develop some more of those cognitive problems, even though we talked about them being less here. They have emotional instability and depression and uncontrollable laughter. That sounds incredibly haunting and really scary to me. The terminal phase, basically the patients are no longer capable of even sitting without support. They've lost so much control of their muscles. There's dysphagia and chronic wound development, and this is typically fatal within 3 months of the development of the terminal symptoms. So treatment, how do we stop it? You just don't eat, people. There's no treatment for any of these. Now, our next prion condition I want to talk about is something maybe that's a little less familiar, fatal familial insomnia. So if we talk about the epidemiology and genetics of this, at this point, this is not thought to be infectious. It's either genetic or sporadic. It is the third most common inherited prion disorder, but very importantly and fortunately, it's exceedingly rare, occurring only in about 1 in 30 million people. The disease typically manifests between the 30s and the 60s, and it's got a long disease course. These symptoms appear and tend to happen for 1 to 2 years. That will be incredibly terrifying when we go through in the next couple of slides what those symptoms are. And there you can see what some of the genetics are and the mutations are associated with this disorder. So if we look at clinical presentation, its hallmark is abnormal vigilance and sleep patterns, hence the name. So during the initial stage, patients appear hypersomnolent with psychiatric and mood changes with abnormal nocturnal sleep patterns. And as the disease progresses, sleep times are further reduced, as well as disorganization of the typical sleep cycles. So as these symptoms develop in patients with this disorder, I want you to think about this. These people cannot sleep at all, other than about 10 or 15-minute spurts, and that even may be with their eyes open. It's not particularly restful sleep, and again, it only occurs in about 10 or 15-minute increments. The later stages are categorized by prolonged periods of abnormal stupor, autonomic abnormalities with hypertension, pyrexia, and tachycardia, as well as movement disorders and gait changes. Now, because of all of these things happen, you're not sleeping, you're moving a lot, your blood pressure's high, you're running a fever a lot of the time, you're sweating, your heart's beating fast. It increased the metabolic demand a lot. So a lot of these patients in these later stages look really cachectic. So let's make our case here. How are prion diseases like zombie infections? So if we look at some of the similarities, the disease starting point may be related to consumption of infected tissue. They cause great changes to personality and behavior, like we see with our zombies in The Walking Dead. They effectively have no personality. They have a singular goal of just eating more whatever, tissue, brains, anything like that. We see autonomic system is greatly affected and there's great dysfunction. There's a great impact on the ability to move and control movement. We don't normally see our zombies in The Walking Dead just running around like normal people. There's some significant changes in their musculoskeletal function. Could be considered delayed dormant, like we saw in some of those later issues. Like we talked about, this is a genetic disorder that's passed down. It may not start to manifest until middle ages. It can cause an insatiable hunger for fatal familial insomnia. Now that's related to increased metabolic demand. And then patients appear wasted, they're not behaving as themselves, and they're unable to control basic functions. Some of the dissimilarities is it's not transmitted by a bite or simple contact with infected fluids. It does not bring people back from the dead. You do not have a craving to eat other people, and you can still be killed by conventional methods. Now, I want to try to make another link here to our zombie infections with rabies. So if we look at rabies, rabies is a negative-stranded RNA virus from the genus Lysovirus. I thought this is interesting because Lysa was the Greek goddess of rage or madness, and this is going to be one of the hallmark symptoms of a rabies infection. So exposure here occurs as a result of an animal bite or scratch where the muscle tissue of the bitten person is exposed to saliva containing rabies virus. From what happens at that point, the rabies virus buds within the muscle cells. It gets into the synaptic cleft of the neuromuscular junctions, and then it travels back up, so retrograde axonal transport from the site of the infection to the central nervous system. Now, once within the CNS, rabies virus displays a preference for neurons rather than other CNS cells. And what's pretty interesting here is that there's a lack of histopathologic damage to the infected cells. if you were to be able to get tissue samples on a necropsy here. What I have highlighted there is important to consider as well. The exact mechanism by which rabies virus causes fatal disease, even in our technologically advanced age, is still not well known. We have to talk about animal reservoirs because this is where the virus starts. In developing countries, rabid dogs account for the vast majority of cases, but that's not the case in the United States. Domestic animals were largely eliminated as a source, secondary to vaccination measures in the 1970s. So our reservoirs in the United States are mainly bats, but also raccoons, skunks, and foxes. In a study that looked at all of the rabies cases from 1980 to 2015, the bat variant accounted for 87% of the infections. Now, small rodents like mice and squirrels and rats are susceptible to rabies, but it's extremely uncommon in these animals, and they don't typically serve as an effective reservoir. For clinical manifestations, the incubation period can actually be really long here, from about 1 to 3 months. And the rapidity of you developing symptoms and maybe even the severity or the onset of the most severe forms of the disease are directly related to where you're bitten. It doesn't happen as quickly if you're bitten in the hand or the periphery. Happens a lot faster if you're bitten on the face, closer to the central nervous system, more nerve intervention there. Now, there are two forms of rabies. There's the furious form, and then there is the paralytic form. For the furious form, the general presentation is fever, hydrophobia, pharyngeal spasms, hyperactivity, and this all ultimately leads to paralysis, coma, and death. So there are a couple of things here that just are really strange, I think, like hydrophobia and aerophobia. So hydrophobia occurs in almost 50% of patients infected, and it's this overwhelming, irrational fear of water. Very unusual, doesn't appear almost anywhere else that I'm aware of. Like aerophobia as well, an irrational fear of air, or pharyngeal spasms that are triggered upon even feeling a light draft on the person. It literally becomes painful to breathe if you have this manifestation of the disease. It also can cause facial muscle contractions in the furious form, a lot of autonomic stability, and again, occurring in about half of the patients, agitation and combativeness. So general arousal, hyperexcitability and disorientation, fluctuating consciousness, and visual or auditory hallucinations. Now, the less common form is the paralytic form, and these patients present with ascending flaccid paralysis. This usually starts or is most pronounced in the limb that's bitten. We lose tendon reflexes, and some of our more unusual manifestations or signs like hydrophobia are rare here. And as the paralysis ascends, there's the onset of dense paraplegia with sphincter tone loss and subsequent paralysis of the muscles of swallowing and breathing, and that is ultimately here what will lead to death. So if we're looking more at our furious form, death tends to occur within 2 weeks of the onset of that coma. And something that I wanted to bring out here is that rabies has the highest case fatality rate of any human infectious disease known. There are some treatments, but we have to think here in terms of prophylaxis. So we have pre-exposure prophylaxis with vaccination, and we have post-exposure prophylaxis. These are the WHO recommended guidelines here for what to do. I won't go through all these. I just wanted to make sure that you understood that it's really treatment. And even if you're bitten by an animal known to be infected with rabies, or maybe you don't know but you suspect, or maybe you're just not even sure, you should go and get post-exposure prophylaxis. Because if you don't, if you let too much time go by, this disease is basically 100% fatal. So let's look at our similarities between rabies and zombie infections. It is contracted from the bite of an infected subject, like zombies, causes strange, seemingly irrational behavior like hydrophobia and aerophobia. Autonomic function is out of control. We see a lot of aggression and agitation, again, a changing in that psyche or your behavioral patterns, which we would see in The Walking Dead with some of those zombies. And like I said, like the zombie plague infection, this is essentially 100% fatal if rapid post-exposure prophylaxis is not employed. The dissimilarities is, again, it doesn't bring people back from the dead, you don't have a craving to eat other people, and you can still be killed by conventional means. So that does it for our look at zombie infections. Now I want to go with something that's a little more grounded in reality, believe it or not, and that's looking at the special DC series Batman Contagion. So this originally ran from March to April of 1996. And this comic series starts with Azrael notifying Batman that a patient infected with a very deadly virus is headed toward Gotham City, and Batman needs to find him because this virus is highly infectious and very deadly. They know that this is something called the Ebola Gulf A virus, and it has caused infections at other places throughout the world, notably here in Central America in the rainforest is where they think this started. So Batman does Batman things and goes and breaks into a classified military site where he knows or believes that they're studying this virus to try and learn more about it so they can try and identify the patient who has it. So once Batman enters this facility, he encounters one of the scientists that's working on it, and he tells him a little bit about the virus. Its incubation period is 48 hours, starts with flu-like symptoms, it's airborne spread, and then some of the things it causes in terms of symptoms, blood leaks from the eyes, it causes desiccation of the muscles, which causes them to tighten up and actually crack bones and cripple the victim, eventually making them severely disfigured. And then we can see that, unfortunately, that scientist is infected with the virus, and you can see his picture there. We won't leave it up way too much longer because it's a little bit disturbing of what this virus does to people and what they look like right there. Much of the rest of this series is them, you see the devastation it causes throughout the city, and Batman and his team are trying to find these other survivors of these past infections. There's only one other known survivor, and they're trying to locate them to be able to isolate something from their blood. What they determine is they find this individual and they determine that there's nothing from their blood that they can figure out to do anything. So they get worried, but then we go back to Azrael, who is learning a little bit more about what's going on, and he figures out that he's seen a formula for this virus before on the wall of essentially a terrorist society called the Order of Saint Dumas, of which he was a member. I'm not sure if he was at this time or not, but he is able to then synthesize a formula that acts as the antidote, and then he brings the antidote back to the city, and all is eventually well. I thought this was really cool because this builds on an actual virus. And as we go through this, you'll see that they did a pretty darn good job of identifying some aspects of the Ebola virus. And in a lot of areas, they hit the nail on the head. We think about Ebola virology. It's a member of the family Filoviridae. It's a negative, linear, non-segmented, single-stranded RNA virus, and it looks pretty interesting. It's a filamentous particle that may appear in the shape of a shepherd's crook, a U, or a 6. If we go back to my slide right beforehand, down there on the left is a very famous picture of Ebola that I bet you've probably all seen. There are 5 known species of the Ebola virus. Ebola Gulf A is not one of them, so that's where they started to take some literary license. The Zaire Ebola virus is the one with the highest known mortality. I have the Reston Ebola virus there with 2 asterisks by it, and the reason I want to bring this up is we'll talk about transmission on the next slide, but the Reston Ebola virus is actually the only one of these that's known to be transmitted via an airborne method. However, it causes significant disease in monkeys and chimpanzees, but it doesn't cause disease in humans. Ebola was first identified in 1976, and its name comes from the Ebola River in the Northwest Democratic Republic of the Congo, where the outbreak first occurred. So this is where the comic gets it a little bit wrong. They talk about it Central America and the jungles. To my knowledge, the real reservoir of all of these infections are in Central Africa and not Central America. We know that the prognosis is quite poor. The average case fatality rate, if you contract Ebola, particularly the Zaire variety, is about 50%, and fruit bats are the suspected natural reservoir. Non-human primates can also contract the disease, and they can pass them on to humans. And in parts of Africa, this has actually decimated the chimpanzee population. So they are not asymptomatic transmitters of the virus. They suffer from the symptoms as well. How is it transmitted? Direct contact with skin or mucous membrane, so urine, saliva, sweat, feces, vomit, semen. Also contaminated objects that are going to break the skin, like needles, syringes, other things like that. You can also get them directly from fruit bats or primates, especially bat guano. A lot of the cases, some of the initial cases anyway, were thought to be coming in contact with infected bats, either bitten or coming in contact with their guano. I have the knots there through the air, water, or food. We talked about the air there. It's only that one type of virus. Food is only if you share food and you get bodily fluids on the food, it is possible to transmit that way. The highest risk for getting the virus are family, friends, and healthcare workers who are providing very close personal care of infected individuals. And what's important here, unlike we see with COVID, transmission can only occur when a patient is symptomatic, and exposed persons must be observed for 21 days. Clinical manifestations, our incubation period here isn't a hard 48 hours like it was said in the comic, but could be anywhere from that 2 to 21 day period. But they hit something else on the head there is if you look at the early signs and symptoms in terms of general things, fever, chills, myalgias, malaise, general flu-like symptoms. But then we have a progression of nausea, vomiting, diarrhea, abdominal pain. We start to get some respiratory symptoms. Then as we progress, vascular signs start to show up like hypotension. You can even get conjunctival injection and edema. Then start to become the really bad things, neurologic complications, headache, and this can even degrade into severe confusion or stupor. Seizure or coma is also common. And then we have a lot of the hemorrhagic complications, so bleeding beneath the skin, rashes forming in their trunks and shoulders mostly. You can even get desquamation of the skin, a lot of bruising, nosebleeds, again, something we saw in the comic. And then finally, in the late stages, really severe, and these patients are pretty much 100% fatality once they progress to this phase. Some of them, though, may survive at any of the stages, and then they can present with some of those convalescent issues, which are perhaps not lifelong, but some long-term complications that can occur after you've been infected with this virus. I won't talk much about treatment, but what's really cool is that there actually is some approved treatment now. Just as of 2020, there are 2 FDA-approved therapies for Ebola, and there are 2 monoclonal antibodies, and the FDA actually did approve a vaccine in 2019. So let's think about, so the virus too was, the Ebola virus, Ebola Gulf A, is called the clench in the Batman Contagion series because of what it does to your body, the deformation and what it does to the bones. So how is the clench like Ebola virus? Well, it's based on an actual viral hemorrhagic fever. As we discussed, though, Ebola Gulf A doesn't actually exist itself. Hemorrhage is a common feature with real Ebola. The virus is transmitted by contact with bodily fluids, which is outlined a little bit in the comic, but is not airborne. The incubation period is mostly correct, and there are definitely some skin changes like petechiae and ecchymoses. Those are frequently observed due to some of the hemorrhagic complications. The dissimilarities, we've already highlighted some. There's no airborne transmission, at least causing significant disease in humans. The other thing is I talked about this being a weapon of bioterrorism from that group, the Order of Saint Dumas. This is not an effective weapon of bioterrorism. How do we know that, you might say? Well, the Russians actually experimented with this as an agent of bioterrorism in the 80s and early 90s, at least given some of the reports, and it wasn't effective enough for them to really use. It's not as efficiently infectious as other diseases. In some cases, it can kill people too quickly. And also because of the lack of the airborne transmission there, that's another reason. And this actually goes into the bullet above, making it not the most effective weapon for bioterrorism. It doesn't turn you into some kind of a monster like we saw with the picture of the general at the military installation. And you're too septic in the final stages to be up and around smashing people with hammers. There's a panel that I didn't show you earlier on where somebody's fighting back and they're hitting them with hammers. And the truth is that like you're way too sick at those stages to be able to do anything like that. There's unfortunately no simple formula that can cure this, but there are treatment modalities that are available and more effective, and again, a new vaccine. This one we can go through pretty quickly, but I sort of like this too. The next one we're going to talk about is jigsaw disease from an earlier issue of the Judge Dredd comic. So Judge Dredd ran for a really long time, both on its own and as a subset of the comic 2000 AD. It's a British-based comic, actually, that ran from 1977 to 2020. And what I'm going to be talking about here with Jigsaw disease is from program or issue 172. And this occurred in the Judge Child series that ran from about March to October of 1980. So I don't have as many panel pictures here, and that reason is because I could not find a reasonable digital copy of this comic. So essentially what happens in this issue is there is this person, Prosser, who you can see there in the left-hand panel, is a pilot for a gang in the Judge Dredd universe, the Angel Gang. And Prosser is expelled from his spacecraft simply because the gang hadn't done anything evil that day, and they decided to just push him out in a pod into space and just let him be there and die. He ends up crashing on an alien planet called AB, or AB, and while he's there, he contracts this weird disease called the Jigsaw disease, where, as you can see via that panel there on the left, pieces of him just disappear. And this is progressive. There's no cure for it in the comic. You just continue to have these chunks of you disappear until you are completely gone and just vanish. So when I heard about this, this made me think about leprosy, or at least some of the sort of things we consider about leprosy. So let's see if we can make that link. If we talk about an overview of leprosy, it's caused by the bacteria Mycobacterium leprae. This is a very, very slow growing mycobacterium species. And it causes a chronic granulomatous disease that affects the skin and peripheral nerves. And it can also profoundly affect the eyes and the nasal mucosa. We don't think about this disease anymore, but still worldwide, there are 250,000 cases a year, and there are even 150 cases within the US every year. That obviously is not one of the major countries involved in the epidemiology. Those are India, Brazil, and Indonesia. Those are the top 3 countries for new reported cases every year. What happens pathophysiologically is the bacteria attacks the nerves. It causes them to swell beneath the skin, which in turn can cause these areas to lose sensation. Without sensation in those areas, you can lead to injury, burns, cuts, and that can lead to long-lasting damage. And then the infected skin can also change colors. I will show you some semi-gross pictures here in a minute too, but you've got to think about, especially as this involves the nasal mucosa, it can even involve some of the more superficial structures of the ear, and it can be associated, if not treated, with severe disfigurement. I do want to talk about a brief history because I bet everybody has heard of leprosy before. It's been around for a really long time. The earliest possible account is from Egypt in 1550 BC. If we move a little bit further west or northwest from there, in Europe, the earliest account dates from about 62 BC in Rome. And I think this is something that we're mostly familiar with leprosy. It's a disease that has been feared and misunderstood since the beginning of recorded history. When we didn't know that it was an infectious disease caused by a bacteria, it was thought to be hereditary. It was thought to be a curse or even a punishment from God. In the Middle Ages, the people who suffered from leprosy were made to wear special clothing. They had to ring bells to warn others that they were close. Maybe even say things like unclean when they were walking by other people. And they even had to walk on a particular side of the road depending upon which way the wind was blowing. These people were also sequestered for treatment, but although there really wasn't much in the way of treatment, it's more of just to get them away from the rest of the populace, in leper colonies where they were forced to essentially live out the rest of their lives. So interestingly, leper colonies still exist. Now, most of them are in India, but there's actually still one in the US on the island of Molokai in Hawaii. Now, there are only 6 patients there. They're not made to stay there. They just like living there amongst each other, and they haven't left. So why these people are stigmatized and separated has to do with what I was talking about. It all stemmed from disfigurement that was associated with untreated disease. In terms of the clinical manifestations, some of our general clinical findings, patients typically seek care because they note a disseminated skin condition. They may also complain of numbness, paresthesias, fevers, or weight loss. So we have three forms of this condition. We have paucibacillary, multibacillary, and borderline disease. The paucibacillary is the most mild form. The multibacillary is the most significant form, and the borderline is really kind of in between the two, and this is where most patients present. So I'll show you some symptoms or some pictures of what they look like. You can see like a plaque here for paucibacillary. We see a little bit more dissemination there with borderline disease. And then multibacillary, that patient it has some significant facial lesions that are associated with this. And this may be, again, associated with severe disfigurement. If left untreated, the nerve damage can result in paralysis of the hands and feet, and eventually, over time, the body may reabsorb the affected digits, resulting in the apparent loss of fingers and toes, like that picture I showed you on the first slide we had. Transmission is hard to determine because of the slow-growing nature and the long period of time between exposure and development of disease here. This is thought to be related to droplet transmission. However, it's not easy to catch. You need prolonged contact with an infected individual over many months in order to capture or catch the disease. It is highly treatable nowadays. I won't go through all this, but what you can see here, it's a pretty interesting treatment regimen where you just need a single drug, either rifampicin, clofazimine, or dapsone, and depending upon the form, you just need a single dose monthly for either 6 or 12 months. So how is jigsaw disease like leprosy? Well, for our similarities, in the late stages of untreated disease, portions of an infected person's body can reabsorb or essentially disappear. It can cost people their visual and vital functions, again, like that disease, depending on where it's manifesting at the time. But there are a lot of dissimilarities. You do not actually disappear. This is highly treatable. It's not 100% fatal, and to my knowledge, it is not an alien disease. Lastly, I want to close out today with vampirism and I Am Legend. Now, specifically what I'm going to talk about is the Richard Matheson novella version of I Am Legend, which was first published in August of 1964. There have been many film adaptations, or 3 film adaptations. Most of you are probably most familiar with I Am Legend with Will Smith from 2007. So I don't have great pictures to show you here, so I just have to give you a plot summary. Story centers around Robert Neville, who appears to be the sole survivor of a pandemic which has turned the rest of humanity into vampires. These vampires are sort of subscribed to the traditional European model of vampires, where they drink blood, they are completely nocturnal, and they are repelled by garlic, mirrors, and crucifixes. Now, during the day, Neville hunts these things in Los Angeles. He kills them as they are sleeping by driving stakes through their hearts. Again, another callback to Bram Stoker's model of vampires there. The story arc takes place over years, and eventually Neville begins to research the cause of the pandemic and learns that it's due to a bacteria of the Bacillus genus. Neville also believes that the pandemic was spread by mosquitoes, not as much by bites from infected persons, and eventually Neville is captured by a new group of vampire-human hybrids trying to form a new society, and the interesting turn at the end is they believe he is the monster because he's killed so many of their family and friends throughout the years. So our link here is a little more abstract, so bear with me on it, and it's tuberculosis. So the overview of tuberculosis, we have another mycobacterial species here caused by Mycobacterium tuberculosis. It's been around for a really long time. Fossil records of TB actually go back millions of years, but certainly we have recorded for thousands of years of cases of likely tuberculosis. The third bullet point there is really fascinating. From the 1600s to the 1800s in Europe, TB was responsible for 25% of all deaths. And this remains to this day one of the most common infections worldwide. About 2 billion people today are infected with TB worldwide. And in the United States, we saw our lowest number of new cases ever in 2017 with just a little over 9,100 cases. This is also one of the most infectious pathogens known to man, and it's been known by many names throughout history. Some of those are Greek. I'm not even going to try to say them, but the easier ones for me are the White Plague, consumption, and even artist's disease. We know that this is transmitted by droplet or anything causing aerosolized particles. We know that 30% with prolonged contact with a TB-infected patient will very likely develop disease. this disproportionately affected the poor and immigrant populations because they lived in cramped, crowded conditions. The onset of symptoms associated with TB is very gradual. We have weight loss, fatigue, productive cough, in some of the later stages with larger lung involvement, hemoptysis or coughing up blood usually involved, fevers, and night sweats. Here is the treatment. I won't go through it. Just again, highly treatable with a combination of antibiotic therapy. And you should know that you treat this for a long time, at least 6 months in people without other immune deficiencies. So what the heck here, right? This doesn't make much sense. Why vampires and tuberculosis? Well, what I want you to do for me is think about what people dying of consumption looked like in the 18th and 19th century. They were wasting away, they were coughing up blood, their skin was turning an ashen color, almost like something was sucking the very life from them. Now, particularly in New England in the late 19th century, before the cause of consumption had been identified as a bacteria, family members within a single household would succumb to the infection. You know, a child would get it, and then they would die. The mother would be taking care of them, and then eventually the mother would come down with the symptoms and die, and then the father, and it just decimated entire households. So in an effort to explain, some family members thought their relatives were coming back from the grave and sucking the life from these family members. And one of the most famous cases from this sort of New England flap of this vampire scare was the Mercy Brown case, not Murphy Brown, the television show, but Mercy Brown in 1892, in which Mercy had died. She was a young girl, had died. Many members of her family had had the disease. And neighbors around their homestead had thought that Mercy was a vampire and that she was coming back from the dead and infecting other members of the community. Her father didn't believe this, but allowed her body to be exhumed. Now, when they exhumed the body, they noticed the position in the grave had changed. They looked at her heart. Her heart had fresh blood in it, and there was blood or some kind of bodily fluids running down from her mouth. And she was remarkably preserved for having been dead for a period of about 3 months at that time. So they did the only logical thing. They burned the body, and then they fed the ashes to her brother in an effort to try and save the brother. This didn't work, as you can imagine, and this is one of the last more famous cases of this. So how is tuberculosis like vampirism? Well, it's caused by a bacteria, like Robert Neville found in Matheson's book. Antibiotic therapy can cure you. So again, Neville was trying to develop antibiotics within the I Am Legend book to cure this disease. And he had found a way to actually stem the tide of the infection. Patients seem to waste away like a vampire might. They appear ashen or anemic, like they don't have enough blood. And those in close contact with them will eventually become infected if appropriate precautions aren't taken. And you will be killed by a stake through the heart here as well. The dissimilarities, it's not caused by being bitten by an infected person. Mosquitoes, like Matheson thought in the novel, cannot transmit the disease. It does not allow you to rise from the grave. You do not crave or suck blood or the life from other people, and then drinking the ashes of burned organisms will not cure you of tuberculosis. So I just want to give you a few final thoughts here before we completely finish up and see if anybody has any questions. We know that comics have increased in their popularity since the golden age beginning in the late 1930s. Most comics deal with far-fetched ideas and superheroes, but nearly everything there is grounded in some form of reality. Infectious diseases on this sort of collision course have had an almost incalculable impact on world history and even popular culture for hundreds of years, if not longer. The intersection of ID and popular literature was inevitable, and in some cases, the truth really doesn't have to be stretched that much, as at least some of these examples that I've shown you today. And then my little plug for going into a career in infectious diseases here is that the diagnosis and treatment of infectious diseases, I think, is the ultimate matchup between heroes and villains. Our heroes are our own immune systems and our various drugs that we've developed to fight and kill these bad things. And then the villains, of course, are the unwanted microscopic invaders. And those villains are pretty smart. They develop resistance, and their sole goal is survival. So we have this constant banging of heads, and it is, an ultimate fight for survival, ours versus theirs.